Syphilis is an STD caused by bacteria. It's often called the great imitator because it shows so many signs and symptoms that other diseases have as well. Syphilis is passed through person to person through direct contact with a sore. Sores usually occur on the external genitals, vagina, anus, or in the rectum. They can also happen on the lips and in the mouth. It can spread during vaginal, anal, or oral sex. Women who are pregnant and who have the disease can pass it to their babies. Syphilis cannot be spread through the contact with toilet seats, doorknobs, swimming pools, hot tubs, bathtubs, or by sharing clothing or eating the same or using the same utensils. Many people who get infected with syphilis do not have any symptoms for years, but they are still at risk for late complications if they are not treated. Transmission occurs from a person who has syphilis in the primary or the secondary stage. Many of the sores that happen go unrecognized, so the transmission from person to person, normally they're not aware of the transmission. The primary stage of syphilis is noticed by the appearance of a single sore. There may also be multiple sores. The time between the infection with syphilis can range from 10 to 90 days. Average is about 21 days. The first sore is normally firm, round, small, and painless. It appears where the spot that syphilis entered the body. The initial sore lasts 3 to 6 weeks and it heals without any treatment. However, if the adequate treatment is not given, then the infection progresses to the secondary stage of syphilis. The secondary stage of syphilis includes a skin rash and lesions in the mouth and nose. It typically starts with the development of a rash on one or more areas of the body. Typically, the rash will not itch, and they are associated with secondary syphilis, can appear as the initial rash has healed or has been healed for several weeks. The secondary rash, or the rash for secondary syphilis, can appear as rough red and reddish brown spots on the palm of the hand and the bottoms of the feet. But there can also be different, the rashes can look different and may occur at different parts of the body. They can resemble rashes of other diseases. Sometimes the rashes go unnoticed. Also, symptoms of secondary syphilis include a fever, swollen lymph nodes, lymph glands, sore throat, patchy hair loss, headaches, weight loss, muscle aches, and also fatigue. The symptoms of syphilis will resolve without any treatment. However, if a person doesn't get treatment, then the infection will progress to the later stages of the disease. The third stage of syphilis, the latent stages, appear when the primary and the secondary symptoms disappear. That's when the latent stages symptoms appear. The person can be infected and continue to have syphilis even though there are no symptoms of the disease. The infection still is inside of the body. This stage can last for many years. The late stages of syphilis can show up 10 to 20 years after you first get the infection. The late stages of syphilis, the disease can damage the internal organs. They can damage the brain, nerves, eyes, heart, the blood vessels, liver, bones, and the joints. Some of the symptoms of latent syphilis include difficulty coordinating muscle movements, paralysis, numbness, gradual blindness, and dementia. These stages are serious enough that they can cause death. If a woman is pregnant, then syphilis can affect her baby during pregnancy. It depends how long the woman is pregnant, how brisk the baby is for being born dead or giving birth to a baby who will die shortly after birth. An affected baby can be born without any symptoms of the disease. If they're not treated immediately, they can develop serious problems within the first few weeks of their life. Untreated babies can be developmentally delayed. They can have seizures and they could die. Some doctors will diagnose syphilis. They'll look at material in a special microscope, or a microscope will look at the sore. They'll look like the syphilis bacteria that are present in the sore will be showed up on the microscope. Also, the doctor may do blood tests to determine if a person has syphilis. After the infection occurs, the body makes syphilis antibodies that can be detected by using an accurate, safe, and inexpensive blood test. You're likely to have a low level of antibodies in your bloodstream for months or years after the disease has been successfully treated. Because a woman who is pregnant can go untreated, the woman can infect and possibly kill the developing baby. That's why it's important for every pregnant woman to have blood tests for syphilis. Genital sores caused by syphilis STD make it easier to transmit and acquire HIV infection sexually. There is an increased risk for acquiring HIV if exposed to the infection. Ulcerative STDs that cause sores, ulcers, or breaks in the skin or mucous membranes, such as syphilis, they disrupt barriers that provide against infections. The genital ulcers caused by syphilis sometimes start to bleed when they come in contact with oral and rectal mucosa during sex. That increases the infection and the risk of getting HIV. Having any other STD is a big predictor for becoming HIV infected because STDs are markers for behaviors associated with HIV transmission. In the early stages of syphilis, it's easy to cure. All you need is just one single injection of an antibiotic into your muscle, and it can cure a person who has had syphilis for less than a year. You might need additional doses to treat someone who has had syphilis for longer than a year. People who are allergic to penicillin, there are other antibiotics that are available to treat syphilis. However, there are no home remedies or over-the-counter drugs to help cure syphilis. Treatment will kill syphilis. It will not repair any of the damage that has already been done. It's important that a person be screened for syphilis because there is effective treatment that's available. They may be screened on an ongoing basis if their sexual behaviors put them at risk for an STD. A person who has syphilis and is receiving syphilis treatment must abstain from having sex with a new partner until the syphilis sores are completely healed. People who have syphilis need to notify their previous sex partners so that they can also be tested and treated if they have syphilis. Having syphilis once does not protect you from having it again. Following successful treatment, people can still get infected. Only lab tests can confirm if someone does have syphilis. Because the sores can be hidden in the vagina, rectum, or the mouth, it may not be obvious that a sex partner has syphilis. If you think you do, you need to discuss with your doctor to help determine the need to be retested for syphilis after you've already been treated. The best way to avoid transmission of any STD, including syphilis, is to abstain from sex with random people. Have a long-term relationship with one partner who you know has been tested and is uninfected. If you're out having sexual relationships with multiple partners, you can get at risk for having STDs. That's why you want to make sure that you're in a relationship with just one person, because you know their history and you know that they're protected. They can happen, genital ulcers, diseases like syphilis can happen in both male and female genital areas. That's why you want to make sure that that the area is covered with a condom and then help reduce the risk of getting syphilis. The condom has to be used properly and must be protecting the area that has been exposed before. Transmission of any STD, including syphilis, cannot be prevented by washing the genitals or peeing or douching after sex. If there's any unusual discharge, sore, or a rash in the groin area, that should be a signal to stop having sex and to see a doctor immediately.